that we're going to discuss today, because we're going to spend today really pushing into proprioceptive neuromuscular facilitation. It's important for you to understand the terms. They will definitely be in your future somewhere. I really kind of try to host this specific conversation today with more of a feel like I would be teaching a continuing education class. Not necessarily like I would be teaching entry-level PTAs, but rather seasoned PTAs. And so the way I'm coming at you is I have an expectation that you're going to kind of know some of these terms that we're using, but also I'm going to build up and on some of these items. And we're going to reference some things from some other classes. We're going to reference some things that you've not quite gotten to yet, but hopefully they will pin a foundation for you when you get there. So beginning, let me start with number one, and that is PNF patterns. Now, what we did in the mobility section or module, we talked PNF stretching, right? And what were those two big stretches we now know? Hold, relax. Agonist, hold, relax, and agonist, contract. They would fall here in techniques. And so we're not going to mention those in today's talk. What we're going to do is just understand that you know those. However, those are techniques used for stretching purposes. So we're using them, and help me out here. You all wrote this to address what? What do we use stretching to address?
Loss of range of motion.
I like them, all three. But to increase range of motion, right? That's what we're doing. In this instance, what we're probably looking to do is to create stability, right? That's the name of the module. So this is all dedicated to utilizing a stability model. So with that being said, we're going to start over here with PNF patterns. Now, a PNF pattern, so that you know, well, before I even go there, I need to confess that most of what today's talk is coming from is this book. You ever seen it before?
Yes.
Yep. Chapter 9 is 100% dedicated to PNF. And so if you want more information, then I'm going to encourage you to independently study Chapter 9. However, everything you need for what we're going to do is going to be right here and right in front of you. And so this is your template or your outline, and then this is the content that I'm going to talk about. All right? So that being said, let's talk PNF patterns. Now, we've discussed techniques or interventions. Let's talk patterns. Patterns are basically the blending of the three planes. However, when you see a pattern that's PNF identified, what you need to know is they are diagonal. All right, so in your notes, the very first thing it says is, or it's actually the second thing, is they're diagonal. Now, somebody do me a favor here and demonstrate what diagonal would look like. I mean, let me just kind of help you out here. You have a plane that goes this way, called what?
Sagittal.
You have a plane that goes this way, called
Frontal.
And you have a plane that goes this way, called. And Mr. Carroll is back there judging you on your enthusiasm of those words. But what if I told you now, let's change this and let's talk about a plane that is this? Then we would say, nope. Then we would say diagonal. You're good, but hold that one. We would call it a diagonal. All right? Everybody's aware of what diagonal means, right? So when you see the word PNF patterns, I need your brain to default to diagonal. It's a new one. It's a new one, okay? And for that, what we're going to talk about is upper extremity and lower extremities. And each of these have their very unique movements. However, they're basically the same when you hinge from the most proximal joint. Now, I just gave you a big indicator. What's the most proximal joint of the upper extremity? Say it. No. Yes, but say it the right way. We're in lab, huh? The glenohumeral joint. What's the most proximal joint of the lower extremity? Bill is about to get 9 kinds of mad right now.
Is it the IS?
The IS? The IS is in the ASIS?
There's an acetabulum and there's a femoral head, and I don't know what you call it.
What the hell do you call that, Adam?
Yeah.
What,
Smiling.
what is there
It's
not
really
a term like glenohumeral? Is there not something like that?
Poop eating grin behind my mask. Maybe you can see in my eyes crinkling.
Okay.
What is it?
Yep.
I'll take the hip.
we went with GH on the first one. I
Femur,
assumed there was something.
acetabulum, most proximal. So here's what you got to know. Now catch this. It's not written here. The upper extremity, most proximal joint, shoulder, most proximal joint of the lower extremity, hip. You got to focus there. You've got to focus there. What they do dictates this junk right here. Flexion and extension. Everybody show me shoulder flexion. Come on, get it up there. That's shoulder flexion, right? Now show me shoulder extension. Show me hip flexion. Show me hip extension. All right. So everybody knows that. Now I'm going to ask you, please impart that upon a diagonal. Do it again.
You know how they cut?
Fruit
Ninja. I thought, I don't know.
Okay, wait. You did 2 movements. You did 2 movements.
Yeah.
Come up here. All right. Spin. No, the other spin.
Okay.
There you go. Show them that first movement again. Just with your right hand, diagonal and back down to your right. Okay? You see it? That is exactly right. This is diagonal 1, right here. Now, what's the shoulder doing? Say it. This is shoulder what? Say it. Shoulder flexion. This is shoulder. Correct. Let me do it again because I don't think everybody saw it. This is shoulder. Shoulder. Right. And so all we're doing is we're going to focus right here. We're going to say, that's what I'm looking at. Now, this is a great diagonal, but there is another. And it starts across the body. And as long as it goes in diagonal, right? Do you see that's a diagonal? This is called diagonal 2. And the reason it's called 2 is because it starts from the contralateral side. Ipsilateral, D1, here. Contralateral is D2. So if you're looking at the right arm, and it suddenly starts from the left side, it's going to diagonal. That's it. That's all. It cannot do, listen, it can't do any of this business. That's not a diagonal. That's transverse. It's coming here. Right? This is diagonal. You all good? This is diagonal. In fact, there's a wonderful graph down there. Do you see it? And what's it show? Diagonal only. Now.
So you can't start here. It has to start at this other hip.
For diagonal 2.
Yeah. And so even when I can't just and say diagonal 2, it has to be okay.
Okay? Ipsilateral, diagonal 1, contralateral, diagonal 2. Now, I'm going to give you a little quiz. I use the right arm. Let me use my left. What am I doing? Diagonal what?
1,
What am I doing?
2,
What am I doing?
transfers.
Internal, external rotation.
Okay? Alright? So these are different concepts. Just like I said in class this morning, it's just a different concept. It's just a new concept. Don't try to blend these things. Just understand it's a new concept. And so the upper extremity has a diagonal 1, diagonal 2. The lower extremity, it has a diagonal 1, diagonal 2 too. This is really hard to do because unlike the upper extremity with this super mobile scapula, there's another proximal joint that relates to the scapula in the lower extremity, but it's the pelvis. And as you know, the pelvis doesn't move a lot, right? And so you're not going to see this gross movement like you do in the arm. So please just kind of watch. Right leg, what it do? What pattern is that? Diagonal what?
1.
Diagonal 1. Diagonal 2, right? So you're just focused on the hip and the shoulder at that point. Is everybody good at that point? Okay. So, moving forward from there, that's not all. You see, we have shoulders doing flexion, extension, hips doing flexion, extension, different diagonal patterns, but there are more joints to the equation, right? For example, let's start from the most crucial, and that is after we see the shoulder flex or extend, after we see the shoulder extend or flex, did you see it? Extend or flex, we have to understand, did the shoulder internally rotate or externally rotate? Now what I want you to do is start with D1. Everybody get an arm down. I don't care if it's your right or left or your other left. What I'd like for you to do is I'd like for you to take this position right here. Not anatomical position. This is anatomical position. I want you to take and go dorsal side of hand. And I want you to come across your body in a diagonal. What did you feel your shoulder do? Did it internally rotate or externally rotate?
Internally.
What felt most comfortable when you came across your body? Watch it. When I come across all the way, and I want to live out my whole motion right there. What's more comfortable? Is this more comfortable? Oh gosh. Or is this more comfortable? So what did your shoulder do? Did it internally rotate or externally rotate? All right. So let's pause. Let's hit record for just a second here. Okay? When you hit record, what I want you to do is say, when my shoulder flexes, it also, what? What rotation?
Internal.
External. See, when it flexes, it wants to externally rotate. And here, I'm going to give you a big cookie. Every time you have shoulder or hip moving into flexion, you also have external rotation. And every time your shoulder or hip moves into extension, you also get internal rotation. Go down to that little box with the circle and the diagonals. And do you look down low? And this is not the legs, because the legs have their own. Look down low and you see extension. And what do you see between extension?
Internal.
You see internal rotation. And then look up. What do you see between flexion? External rotation. So whatever you have to do, I mean, it doesn't matter to me what you use to do this with, but when you have shoulder flexion, you always have external rotation. At extension, you have internal rotation. And so, the way I remember it is that right there. Fur and ear. Flexion internally rotates, extension externally rotates. Now, I said that like internally rotates. Now, this is where this is going to come up. You're going to be taking your licensure exam, and you're going to be in there, click, 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 and you're going to run into this question. It's going to say, PNF pattern, what does the elbow do? And you're like, crap, that doesn't answer the question. And so you're going to be sitting in your little mini cubicle, looking at your mini computer, with nothing but a mouse in front of you and a pencil and a piece of paper. And you're going to take your arm, and you're going to go to D1. And you're going to come diagonal. What does the shoulder do? It flexes, externally rotates. What does the elbow want to do? It flexes. Okay? That's another critical component. The elbow will flex. So, we'll see flexion, external rotation. I'm going to run right into my blue here. Elbow flexion. So, this is kind of seemingly opposite, isn't it? Because opposite, 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 opposite. What do you think is coming? Predict the trend.
Opposite.
Okay? So, let me show you what I'm doing. My elbow extends with what? Shoulder extension. So in an extension pattern, that's what I'm seeing. So go back to my little graph. And you see it there. So external rotation, elbow extension. So let's try this. Go back to D1. Diagonal 1. Shoulders extended. There's also ulnar deviation. That's a new term? Or is that a good term? You all good with ulnar deviation?
Yeah.
Are you only saying that because Bill's back there?
No, we know that.
Okay. Here, it's going to diagonal. It's only going to go this way. Internally rotate. Shoulder flexes. Wrist does what?
Radial deviation.
Huh?
Radial?
Radial deviation. The opposite. Okay? Well, you have to remember what the shoulder does, and then the rest will just kind of roll in. It'll roll in because you'll be sitting there thinking, what feels normal? Because that's what this is about. It's about encouraging a normal, functional movement pattern.
I don't see the external rotation on the shoulder.
I don't either.
All right? I'm going to pull a bill here. That's midline of your humerus.
Okay.
All right? Right here? Now I want you to watch the line. Start here. You weren't internally rotated. There you go. Now, watch the line.
Oh, wait.
Watch the line. It's so. Get that thing internally rotated.
Alright.
You're not internally rotated. There, now you're internally
okay.
rotated. Okay?
Alright.
You're also pronated.
Yeah.
Yep. Aren't you? Now, come back around, supinate, externally rotate. Bam. Now do you see it?
A
Let me go draw on her.
Yeah.
Don't worry, you can get some time to practice with that. So, let's ask ourselves this question. What is the scapula doing in an upper extremity? What's the scapula doing? Well, from a D1 perspective, right here, feel your scapula. You've got one arm you can feel back here. Go through that and see what the scapula does. Is it upwardly rotating? Is it downwardly rotating? Is it protracting or is it retracting? Ask yourself all those questions. And now, listen, you got to get yourself way over in that diagonal pattern where that scapula is clearly retracting. And if it's retracting, what do you suppose it's doing? Is it upwardly or is it downwardly? What's it doing? I can see a scapula right here. And as it comes up, I see upward rotation and I see retraction. You see it? And as I come back down. Right?
Is the upward or downward rotation named after the inferior angle?
Look at the inferior angle. If it goes this way, or this way. That was really bad, wasn't it? So, if it moves laterally, that's upward rotation.
Yes.
So is that with the
Retract that.
flexion? It's
Well,
over?
I'm sorry, yes, I did say protraction. Sorry. I was hearing two different things.
It was
Something was
radial.
over here too.
Radial? It starts a little more like so soon. Yeah, it starts in radial.
You don't have a good view here. I didn't say. When he's here, that's retracted.
Yeah.
And that's downward rotated.
So then you're
When
going
he
to
comes
be,
here,
it's protracting.
right.
Okay.
And what you also do is you immediately grasp onto the fact that a mobile scapulothoracic joint is needed, don't you?
Yeah.
Don't you? Okay?
Scapula retracts upward rotation.
Oh, I see it.
I said it right first, and the person said, I told you wrong.
I was so confused because it's like, how is that retracting?
All right. So another bullet there says make sure you're doing rotation early. Make sure you're doing rotation early. Now from an active standpoint, what's that mean? That means I'm here, moving to here. Or what if I start from here and I move that way into extension? That means get that rotation early. That rotation's got to start early. That means that when you are doing this passively to a patient or you're here today, make sure you start, as soon as you start extending or flexing, that you also start rotating. Like that's immediate. Those rotary movements are really, I can't enforce that enough. Make sure you start early. And then again, you're taking them from a rested position. And it's most easy for us to go from a rested position to extension and over. Or from a rested position to extension and flexion, extension and flexion, extension and flexion. And so, yeah, you're going to need to spend some time putting your brain to work on that, both passively and actively. And as we kind of go throughout the afternoon, I'm going to show you some techniques with the legs too, and really where that comes in. But first, I need you to grasp on to the upper extremity. Think about the shoulder. What's it doing? Is it flexing or is it extending? And if that's what it's doing, then you immediately go into the rotary movement, the elbow, and then consider the supination and the pronation, and then what's happening at the wrist. And that's where I'm going to stop. I'm not going to take you into the fingers and the tenodesis. I just want you to get to that.
Huh?
All right? So, here we go. We're going to spend 7 minutes, so you don't have long. 7 minutes. Take your patient, put them on the table, passively, D1, D2. Listen, as usual, if they're not doing it right or you don't see it, interrupt them. Hit the pause button and say, don't practice bad habits. Get somebody else in there to testify. Or get me over there. Or Mr. Bill or somebody.
So for
Go.
flexion, was it scapular?